This episode of The Benefit Whisper is brought to you by Route 3 Insurance and Financial Services, where smarter benefits begin. If you're tired of rising healthcare costs and opaque insurance contracts, Route 3 is here to help you take control. They specialize in transparent, employer-driven benefit strategies that protect your people and your bottom line. Ready to break away from the status quo? Visit www.fixmybenefitsnow.com and discover how Route 3 can help you build a plan that actually works for your team and for your budget. Hello, and welcome to The Benefit Whisper, the show where we pull back the curtain on what's really driving your healthcare costs and what you can do about it, feeding a system that's really rigged against you. My guest today, and I've been looking forward to this for a long time, is Chris Deacon, the former director of health benefits for the state of New Jersey and the author of a new book, which is fascinating. It's called The Great American Healthcare Heist. And it's not just a catchy title. It's really something every employer, taxpayer, and plan sponsor should be looking at when they're paying for other people's profit, in their own shadow. So Chris has seen how the sausage is made from the inside, and spoiler alert, it is not grass-fed. So let's go ahead and jump on in. Chris, what made you decide to write The Great American Healthcare Heist? Was there a breaking point or, in the time you were managing the New Jersey health plan?
Yeah, so I decided to write The Great American Healthcare Heist because I really needed a tool in my toolbox when I was going to other policy leaders and legislators and people that are influential in the purchasing community to educate. I was asked so many times, is there a book that really puts all these pieces together? And so I didn't find that tool, so I thought I would create it. And that was really where the idea was born.
Excellent. And it is a great read. I grabbed it on Amazon, both the Audible version and the hard copy. So I love it. It's great. So let's define heist. Who's pulling it off and how in healthcare?
Yeah. So heist is, aside from being a great alliteration with healthcare, is the perfect word because a true heist, like a good heist, has several different actors that are involved, all working sort of together in a coordinated and synchronized way to pull off the heist, right? And that's why in the book, I don't just focus on one bad actor or one industry within our industry. I pull back sort of the curtain on all the pieces to show how they're all benefiting when we're spending more on healthcare, without all benefiting when we're not getting healthier as a country and we're actually sort of going in the wrong direction.
Right.
So that's where heist came from, and all of the players, right? I really don't hold back in implicating each part of the industry, but also the elected leaders and regulators that are responsible, for enforcing our laws and protecting us from some of this predatory behavior.
Yeah, I agree totally. Years ago, I was working with the state of Tennessee. We're looking at their health plan and the waste in it. We analyzed, I don't remember how many lines of claim. They had $2.7 billion in billed charges. And within any given procedure, and the one example that I always remember is CT scan of the abdomen with and without contrast. The median charges were $635. The high was $19,800 for CT scan. So I'm always amazed to see those variations. And back that, I did that in about 2018, and we weren't even looking at the PBM part then, which, of course, is a huge part.
Right.
So, Chris, what surprised you most, if anything, when you started looking under the hood, the healthcare contracting and vendor details?
Yeah, I think probably most shocking / surprising when I really started digging in when I first got to the division where I ran the healthcare plan for the state was just how status quo and sort of complacent the industry was in terms of our consultants and our TPAs and our PBMs. I remember being in a meeting, and it was one of my first meetings. We were talking about our TPA RFP, and the consultant said, we're going to evaluate the bidders in two ways, discounts and disruption. And I stood up in a room full of, 20 people, and I said, how do you buy off a discount if you don't know what the underlying price is? We're going to get that, right? And they looked at me like I was crazy. when in fact it's crazy to buy something without knowing the price, right? And as far as disruption, the assumption that any disruption is bad, right? And I said, I
Uh-huh.
understand that we don't want people to have to move their doctors in the middle of treatment, and I get that. But what if we are removing hospitals, facilities, physicians from our network that are poor in quality? Like, isn't there a good
Hmm.
disruption? Like, where do we account for
Yeah.
that? And I, again, crickets. So
Wow.
just sort of like the lack of willingness to question how we do things because we've always done them that way.
Yeah, yeah, that's it, because we've always done it that way. Exactly. And healthcare's so complicated, healthcare's different, et cetera. Years ago, I was bidding on a municipal group, 5,000 employees, not huge, and they had the same thing. We're gonna judge this RFP based on discounts, okay? And this is gonna be 30% of the scoring, or I forget what it was. I approached a local hospital and I said, "Are you interested in doing a direct contract for 5,000 employees, plus their dependents, probably about 8,000 people total?" And they said, "Yeah, absolutely." And I said, "Well, what kind of discount can you give me?" And they said, "Well, what do you want?" And I said, "Well, what do you normally give like a Blue Cross, Cigna, type, big network?" And they said, "We're around the 50% mark, 49 to 52." I said, "Okay." And then I thought it was being crazy. And I said, "Well, how about a 75% discount?" They said, "Yeah, sure, no problem." And I thought, "Oh, wow, I've got this. I've got this." But then they said, "But listen, normally our charge master is 400% of Medicare to give a 50% discount. So we're going to have to go to a charge master of 800%. So I'm doing the math. 75% off 800 is the exact same. So that really, for me, was a coin drop moment where, yeah, the discount game is a shell game. Absolutely.
Right,
So
right. That's a great story. I love that.
thanks. So if you had to break it down, in your mind, and especially seeing the results of what you did, how much of the current healthcare spending is pure waste, misaligned incentives, or even fraud?
Yeah, I think the common number thrown around there is around 30%. I think that's pretty conservative. I would go anywhere from 30 to 40.
Wow.
Yeah.
30 to 40%. Wow.
Well, if you
And
if you're adding in
mhm,
sorry, if you're adding in, administrative waste and all of the money that's spent, as a result of the misaligned financial incentives, then yeah, I think we're there.
yeah, wow, that's huge when you think that we spend over $5 trillion a year on healthcare. 30% of that, that's $1.5 trillion that we're wasting. That is it's amazing, but it's very sad. And, as you mentioned up front, we're not getting necessarily better outcomes from all that spending. So, wow. Wow. 30%. So any employer listening or plan sponsor, if you think of your total spending and think of reducing that by 30%, what an impact that would have on your bottom line. And it's really something that is eye-opening, or should be.
Right.
So let let's kind of switch to the PBM part, Chris. Now we spoke to an independent pharmacist called Benjamin Jolly in episode 8, and he told a little bit of the story about the New Jersey bid for the PBM, okay, which we talked about. But you were the one controlling that RFP. Can you walk us through what happened and how it happened and what the savings were, et cetera?
Sure. So we actually conducted a pretty unique process, especially in the public sector, because it actually required us to change the law in order to procure in this manner, because it's not a
Hmm.
typical procurement. So it really was, a team effort. We had to have, legislation passed and folks behind that. But we did a reverse auction. So essentially, we pre-qualified bidders. So before you were even able to take part in that process, you had to agree to our contract terms. So 100%, pass 100% pass through. You had to agree again to all the technical terms. And if you weren't willing to agree to our contract, you couldn't bid. So once you get through phase one, then you go on to the actual bidding process. And the bidders are able to see where they stack up against their competition
Hmm.
in a few rounds of bidding. And
Wow.
so ultimately that process led to, I think, over the life of the 5-year contract. It was several $1 billion, 2+ billion in savings,
Wow.
based upon where we would have been, just because they get more aggressive in seeing where they're landing against their competition. Now, I will say, that was 1.0, in terms
Hmm.
of a reverse auction and how innovative you can get.
Hmm.
Unfortunately, I was no longer there in time for what we had planned, which was 2.0,
Hmm.
which was to move beyond, having a PBM price out their own formulary and what their guarantees would have been, and then been able to put
Interesting.
put in place our formulary, like where are we finding value, because we truly
Hmm.
wanted to get to lowest net cost, and we weren't convinced that the PBM model, at least as it currently is, and
Hmm.
their formularies were the best we could do. It was a step in the right direction, but we could go further.
Yeah. Recently, I was involved in a bid on a health system. They had about 15,000 employees and they were spending, I think, about $70 million per year just on their pharma.
Uh-huh.
Okay. Which I think was pretty high. And we proposed exactly what we were talking about, pass through. Okay. Saving potentially $28 million a year. And I think that sometimes consultants that don't really, either they don't really understand or maybe they're profiting from the higher spend. So anyway, it didn't happen. I think that eventually it will because, you've got people like yourself, Mark Cuban out there just talking about, wake up people. We also had a guest, I don't know if you know, Julie Sleznick. She's very
Oh,
involved
yeah.
in the litigation on some of the class action suits and stuff. So it's been very interesting. And I think that one of the things that's huge that people, they ignore is the fiduciary duty of the plan sponsor.
Yeah,
You know,
absolutely. Yes. And Julie is doing wonderful work to bring more awareness to, the F word in a good
yeah,
way, right? To not
yes,
only
yeah,
convince employers that it's in their best legal interest, from a
mhm,
protection standpoint against lawsuits, but
right,
also I like to point out that it's not just how do you protect yourself from getting sued for breach of fiduciary duty. It's taking
yes,
the fiduciary framework, and, when you run your decision making process through those 5 pillars,
mhm,
act only in the plan and plan participants' best interest, only pay reasonable costs. Like, when you do that, you will arrive at a better decision for your plan and a more financially
yeah.
advantageous position for your plan and your members. I firmly believe that. So, carrot and stick.
Yeah. And just as you said earlier, the size of the discounts, too often in a PBM bidding process, I see discounts off of AWP or WAC or, something like that, which, again, a discount is the old story about how, some of the big department stores getting ready for the Christmas sales and Thanksgiving, they started marking everything up so that they can give a bigger discount, which is
Right,
again, a shell game.
right, right, exactly.
I'm so glad you're beating this drum, and your book is amazing. We're going to talk about that in a little bit. So let's say I'm a mid-sized employer with a self-funded plan. Am I likely falling into some of the things that you've been talking about without even noticing it?
Yes, I would be surprised if you weren't. And that's not to say that you're not doing your job as a mid-sized employer. Mid-sized employers generally don't have a huge HR team, or certainly the sophistication
Right.
in an HR team,
Mhm.
finance, legal, contract negotiations. So again, I don't think that there's blame to be passed. And also, there are a lot of hidden games and that are intentionally hidden from you. You talked about the PBM, and that public sector bid that you didn't ultimately go with the PBM model. I don't know if you saw, but earlier this year, I disclosed on my LinkedIn page. Actually, Gallagher was involved in, requesting a $2 per claim fee from a
Mhm.
vendor, right, from a PBM, and those games are happening, right. In order to get even considered, sometimes for a PBM bid, the consultants are requiring you to pay them a certain fee upfront or per claim fee. And most employers are not aware of this. They have no idea.
Mhm.
Um, yeah. So again, not casting blame, but a lot of employers, especially the midsize, are in a tough spot because they
Yeah.
don't have the tools and haven't had the tools to to figure this stuff out.
And how can an employer figure this out or find this out? How could it be, exposed? How can they find out if that's happening?
Yeah. I mean, I think that step number one is to go out to RFP and get yourself a consultant and broker that's working in your interest, right? That
Mhm.
is doing sort of a flat fee compensation, that is willing to really give you all you're asking for from a transparency perspective on commissions and overrides and every revenue stream that they're deriving from vendors that you may be using in the future or are using currently. I actually just finished up a project for a large financial institution where I actually came in and helped them run their RFP for their consultant. And it's money well spent for these types of clients because they're getting in place somebody that can now help them uncover some of the games. So I think step number one is getting the right consultant. And that might mean, unfortunately, that might mean breaking off some really long-standing relationships, at least from a professional
Mhm.
perspective. But that sometimes
Right.
is what has to happen.
Absolutely. I couldn't agree more. It's, like a second opinion for medical condition. Sometimes it's definitely worth having it. Like if you've got something serious and in many times it'll reinforce the first one, but if it doesn't, then you've got something else to consider. So that's very, very interesting. And I think a third party consultant that doesn't have skin in the game, just kind of looking under the hood is a great idea. Also, the contracting. You talked a little bit about that. Getting back to the PBM in New Jersey story, tell me about like you did the reverse bid based on your terms. Can you get into that a little bit deeper? What did it mean in regards to the contract wording, et cetera?
Sure. As the state, we had the benefit or privilege, if you will, of setting our contract terms up front, right? We
Mhm.
define what specialty is. We
Okay.
define what rebate is, right? So when we defined rebate, because if we have a, fully pass through all rebates, I need to know that my rebate definition is consistent with what your internal rebate definition is, PBM,
Right.
because it is very
Yes.
easy for that PBM to go upstream to their GPO and say, maybe we don't call them rebates. Maybe we call them something else, right? Which would
Mm.
then allow them not to pass it on to me. So, getting smart with definitions, asking for ongoing disclosures. So, again, I understand that we had, as an 800,000 life group, there are certain things that we could do that not every employer can do, like setting our own
Right.
contract terms. But what I
Mhm.
will say, and what I've done for, clients like this financial institution and others that I've helped with RFPs, is you can ask them to redline contract language or
Mm.
make it, if you have a few priorities, perhaps it's a definition of clean claim, or perhaps it's audit rights. If you have a few key priorities, you can make it your qualification to bid conditioned upon your willingness to agree to this term. You can only be our TPA if you agree to give us our claims in this format and attach the format to the RFP. I think the
Right.
more, it is in the contracts, the more we set ourselves up for success in the contracts up front,
Mhm.
the easier it's going to be for us to actually manage this contract downstream.
Yes, exactly. And, anything is agreeable or explainable if you know the terms. So,
Right.
knowing those terms and looking at it, and too many RFPs that I've been involved in, the consultant, well, okay, so sometimes you have two things. You have the incumbent, whoever is the current consultant or broker. But, even sometimes when they bring in a third party, that third party may not be asking the right questions. So, what we do when we're in that area, we look at the contract, we read it. We read it on every bidder. We scan the language and we try to normalize it across. We do a chart so that you can see apples to apples. And as I said, there's so much, as you said, waste, and it is discoverable and it's definable and it's findable. So, of the approximately $2 billion that you saved in the first 2 years, so about 400 million a year, was that just on the PBM part of the
Just,
contract?
yes, just the
Wow.
pharmacy.
Okay.
Yeah.
So 800,000, was that employees or total members?
Total lives, 820,000 across active
Okay.
retiree. Yeah.
Mhm. Wow. Okay. So that's substantially large. That 400 million a year approximately, was that a pretty large percentage? Well, actually, let me back up one step. Do you remember approximately what the PBM spending was as a part of the total? What percentage was? I normally see, like I think the average now is about 23 to 25%.
Right. I
Do you
think
recall what it was?
at the time we were around 15 to 17%. We always hovered a little bit
Oh, okay.
higher than the commercial book. I
Right.
mean, if you were to look at the rate renewals now, I mean, it's really
Mhm.
exploded, and that's an area that
Yeah,
they're
yeah,
really struggling with.
of course.
But yeah, I mean, it was a substantial piece. I think again, we were a few points above commercial benchmark, but
Mhm.
yeah, it was a large chunk.
Yeah, wow. So that savings was substantial. In addition, was there anything saved on the health plan spending outside of just the PBM?
Yeah, so we did a few, different initiatives that resulted in a few hundred million savings in over the course of a few years. We went out to RFP again on our TPA, and we
Mhm,
actually, for the first time, we moved away from discount guarantees. I said, That's not how we're buying healthcare this
mhm,
year." So we did a unit cost guarantee analysis. We priced out services at a 3-digit zip code
mhm,
and then made the vendors put guarantee price inflation. So, for example, for this particular DRG and this 3-digit zip code, the price
mhm,
is not going to go up more than 3%, let's say. So it was an innovative model, an interesting model, and it really did expose some of the flaws in the discount model, because had you analyzed
yeah,
some of these claims under the discount model, it would have looked like a fantastic discount. But when you looked at
mhm,
them from the unit cost perspective, you saw, that you were actually going in the wrong direction. And there were actually
right,
some pretty substantial financial penalties assessed in the first 2 years of the contract, because they
mhm,
realized that, what are the two things they have to do in order to hit their guarantees? They either have to lower the price, right? Or they have to get people to the higher value provider, right? And
mhm,
stop using the highest price facilities. So yeah, we did, several things like that. In the end, in 2021, we were able to give a premium holiday to our teachers and our uh, state workers. But unfortunately, a lot of the work stagnated and unfortunately has come undone. The PBM
mhm,
contract hasn't been put out to bid in several years beyond the
mm.
extension period, and they're hurting. I think their rates have gone up almost 20% every year for the last 4 years. Mhm.
And that's not just because costs are catching up because you had a reduction in a few years, is it?
No, no.
It's
I mean,
be
the
mhm,
data tells you this is a price problem. This is not a utilization
yeah,
problem. This is not a pent up
right,
demand
right.
problem. This is very
Well,
clearly a price problem.
I'm not sure if you've ever spoken to Marilyn Singleton or Dale Folwell, who tried to do things. Well, Marilyn was very successful in her state in really reducing costs. Um, you know, I think this is something every state needs to look at, and every employer needs to look at. And I
Yeah.
think your book is a great starting point. Now, Chris, we have a lot to talk about. I would love to talk to you on another episode, if that's okay. Would you have
Yeah,
time for that?
absolutely. Of course.
Excellent. Okay, great. So, Chris, thank you again for joining me. This has been exactly the kind of candid conversation we need to have more in this industry. So, your book, The Great American Healthcare Heist, is absolutely a must read for anybody that thinks they're making an informed decision in the healthcare spend. So before we sign off, if folks want to follow your work, buy your book, or connect with you, where should they start?
Yeah, if you'd like to follow me or connect with me, LinkedIn is where I post most of my content, and it links to all my other Substack and articles. And then the book is available on Amazon.com. It's also linked there in my LinkedIn. I hope you enjoy it, and if you enjoy it, give it as a gift, because knowledge and education in this space is huge, and we have to rally behind that.
Absolutely. Thank you so much, Chris. I'm Ralph Weber, the Benefit Whisperer. And if you got something out of today's chat, do me a favor, subscribe to our YouTube channel, to our feed, comment, or share it with somebody who could use it. If you've got questions for future episodes or suggestions, hit me up at ralph@thebenefitwhisperer.com or call 832-924-3330 or visit www.fixmybenefitsnow.com. Thanks again for being here, Chris, today. Thank you.